Okay, fantastic. Hey everyone. Thank you very much for joining us this evening for our fantastic event with Gay Global. Did I get that right?
Yeah.
Yeah.
Yes. And Code in Black Females, where we'll be talking about tech for good, global health and human rights. So for those of you who haven't been to a Code in Black Females event before or don't know about Code in Black Females, we're a community of Black women in tech, and that's in UK and abroad and everywhere. It's absolutely fantastic. We're a really high energy organization. We are here to provide opportunities and training programs and mentorship and anything we can to try and support Black women getting into tech and being supported whilst they're in tech. We're really excited about the event that we're having tonight, which is going to be from Maud and Taff from from Cadgay Global. There we go, I said it. Because they're going to be giving us some insight into some research they've been doing around global health and human rights and how we can use tech to have a positive impact in that space. So over to you. I'll let you introduce yourselves.
Cool. Thanks for that, Charlene. She said, my name is Maud and this is Taff from KJ Global. I have a human rights background and Taff has a global health background. So we started this organization basically to try and have an inclusive perspective in terms of tech, global health and human rights, given that technology is advancing and it's rising so much. So KJ Global, what it is about is basically about the inclusivity of technology in terms of human rights and global health. And what we try and do, our goal is just to ensure that global health and human rights implications of technology are considered just to ensure an inclusive future. You want to?
So I think you've covered most of it. We work kind of collaboratively with businesses and educating students as well on kind of the importance of incorporating global health and human rights into tech. So kind of helping the businesses understand the impact they're having on communities or populations, and also helping incoming graduates into the field understand the impact that they can have as well. And then hopefully through that, we hope, as Maud said, for a more inclusive future, given that technology is going to play such an important role in how we live. So that is about us. Am I okay to start sharing the screen? Yeah. Cool. Okay, let me know if you guys can see it.
Yep, is that visible to everyone?
Yeah, it's a bit small. I don't know if you can make it bigger.
Yeah.
Bigger, yeah. Is that better?
Yeah, absolutely.
Perfect.
Great. So this is just a session outline of how we're going to structure this event. So we'll start with an intro and then go into what is global health and human rights. We'll do a bit of a few activities here and there, just to get you guys thinking about the inclusivity of global health and human rights in tech. And then we'll give a few case studies and examples and the way forward. But this is meant to be an event which is informing but also engaging, because we want you guys also to think outside of the box and to think about how you can also use your skills to meet all these worlds together. So if we just start with the intro. Oh, do you want to do the ground rules?
Yeah. So just some ground rules. There's first one, no wrong answer, so feel free to say whatever you want. Just raise your hand, preferably, if you have anything to say, and then we can go ahead and pick someone. Obvious ones like mute your mic if you're not talking and stuff like that. But yeah, we will jump right into it. We've already done that, so we'll go to the next spot.
Okay, cool. Global health. So what is it?
Yeah, so global health, it has many different definitions because it used to be quite niche. I think COVID is probably something that brought global health to kind of everyone's everyone's world, but it used to be quite niche. So there are a few variations, but I'm going to go with this definition here. it basically prioritizes improving health and achieving health equity for all. So which means ensuring that everybody has access to a healthy life. And that doesn't just mean a kind of physical health, that means sexual health, mental health, everything to do with having a healthy life. Also emphasizes on transnational health issues, determinants, and solutions. So what that means is across the world. So unlike public health, global health will focus on many different countries and the causes for diseases across the whole entire world. Also includes many disciplines. So even though you guys work in technology or you're interested in technology, you can also be someone who is working in global health or a global health activist. Global health emphasizes the importance of being multidisciplinary and including everyone in the work that we do to make sure that we can ensure health in all aspects of our lives. And then also it synthesizes this idea of population-based prevention, but then also individual-based prevention. So not just focusing on what is the individual doing, but also looking at kind of what are populations doing, what are communities doing, how is that impacting one person's health ultimately and their health overall as a community or as a country.
Cool, thanks. And then human rights again is such a broad thing, and there exist many variations of what human rights are and what they mean to each person. But I'm just going to give a basic overview of what the basic and foundation of human rights is. So human rights are basic rights and freedoms that belong to every person in the world from birth until death. These apply regardless of where you're from, what you believe in, how you choose to live your life, what you look like, etc. And they can never be taken away, although they can sometimes be restricted. For example, if a person breaks the law or if it's in the interest of national security, those kind of examples. And these basic rights, these basic human rights, are something that are based on shared values that have evolved over time. These values include dignity, fairness, equality, respect, and independence. And these values are defined and protected by law. There are so many human rights articles out there, but the main one, the really big one that actually set this into law across the world is the Universal Declaration of Human Rights. But the ones that there are also some declarations which exist regionally, so America, Europe, Africa. So in terms of Britain and the United Kingdom, we've got the Human Rights Act, which applies to the United Kingdom, and then we've also got the European Convention of Human Rights, which applies to everybody within Europe. So those are the ones that you could use. Mostly, you can't, for people who live in the United Kingdom, it's a bit harder to use Universal Declaration of Human Rights.
All right, so the first activity we're going to do is kind of breaking out into small groups and just thinking of why global health is relevant to technology or relevant to you as a Black woman in technology. There's no right or wrong answer. It's just kind of starting that thinking on like why these topics would be relevant and what you guys think is the importance of ensuring everyone kind of includes these topics within their work and within their life.
Yep, so Tanya, could you enable the breakout rooms?
Sure, I'll do that right now. I'm opening them now. You're muted, Charlene.
Bye. I was just going to say, it's streaming. See you later.
Hi Jessie, just a heads up, we're streaming live to YouTube, so if you don't want to be seen, feel free to turn your camera off.
Thank you.
So everyone's in breakout rooms at the moment, we're doing
Okay.
a little exercise. I will add you to a breakout room with the people who are running the event, so that
Great,
they can
thank
catch you
you.
up.
Thanks very much.
Hiya, is everyone back? Yep, can everyone hear? Okay, great.
Okay. Cool. Yeah, thanks for taking part in that. The next bit is we're just going to get feedback on what you discussed in the breakout rooms so that we can have a bit of more of a discussion on this as a whole group. So does anybody want to offer up basically a summary of what you discussed and what the insights were from your discussion?
And also we missed our introductions bit. So when you say, when you give your point, just give us your name as well.
And what you do.
And what you do, yeah.
Yeah. Anybody?
Or we can, or if you guys don't. We've got someone being volunteered in the.
I'm a bit hurt because I privately messaged her to go. So yes, we had a very interesting conversation regarding data and whether or not what drives the use of technology. So this is why I wanted Fem to go, because I'm not sure if I can explain her example very clearly. But she was saying there was an example with the environmental tech and how it's driven more due to climate change in France, whereas in the UK it's driven more with money and business, and whether or not this data would be useful, beneficial for women as well as Black people, and then obviously Black females, encompassing both. And then I was expanding on the confidentiality of it. So who holds the data, where it's shared, and that social side of it, whether firstly Black females would be in consideration when they are trying to produce the data that would be helpful with whatever the global health situation is, and then the human rights of it, of whether they're sharing that data. And yeah, thanks.
Yeah, thanks. You forgot to say your introduce yourself a bit.
Yeah, my name is Dáre. I am a finance and operations exec at a non-profit charity. And yeah, I'm currently studying data analysis. So that's my intro to tech.
Cool, thank you. And thank you for the interesting points.
Yeah, that was a good point. From a global health perspective, global health is actually at the moment kind of coming to a point where we're starting to combine with the environment. So that point was a good point, and something that's come up kind of in research, because a lot of the research hasn't been so inclusive, meaning a lot of our programs hasn't, and that's across a lot of different subjects within global health, but within the environment particularly, and particularly taking into account kind of the role that Black communities predominantly play. The narrative so far hasn't taken that into account. So yeah, that is a good point. And then regarding the privacy one, that is something that is at the forefront of digital health, because at the moment there is not much regulation and people don't really know what's what exactly is going on and where we're taking that forward, which is quite dangerous when you think of the implications that that can have, and the potentially the negative impact when someone can have health data without good intentions as well. But I'm aware we've only got 5 minutes for this, but yeah, that was a good point. The second group, does someone want to volunteer?
Anybody, don't be shy. No? Okay.
Okay, I will. can I pick? I will pick on someone. Hauwa, is that how you say the name?
Yes, it's Hauwa.
Hauwa.
Yeah, so I think with us, basically we're talking about yeah, I was a bit late to the session, but before we actually had to join this session, we were discussing the impact, how technology can be used to strengthen health systems in communities and societies where we've got inadequate capacity, inadequate skills, inadequate, the health systems and infrastructure is just not there to actually meet up with standards all over the world, and thereby improving the lives of people within that community, especially the African and Black community, and improve the standard of living as well as life expectancy. Yeah, I think that's basically the theme of our discussion from the last session.
Thank you. Yeah, just aware we had 5 minutes for that, but don't want to go too much over an hour. So we're going to move on to the next bit here.
Oh, she didn't say what she does.
Oh, sorry. Yeah, we're going to move on to the next bit where we're going to have a little quiz. So what we're going to do is we're both going to say global health and human rights facts. So they're going to be directly related to global health or human rights. And then everyone is just going to raise their hand if they think technology has played a role in that fact. And then don't raise your hand if you think technology had and nothing, like if you think technology had nothing to do with that fact. Yeah, so if you start with the human rights facts.
Okay. Cool. The first human rights fact: police recorded crime figures that showed that in 2018/2019, that there were 103,000 offenses recorded by the police, where one or more of the central monitored hate crime strands were deemed to be a motivating factor. Do you think that had anything to do with technology, directly related or indirectly related at all? Anybody?
Sorry, could you repeat the question again?
Yeah. So police recorded crime figures that showed that in 2018/2019, there were 103,000 offenses that were recorded that basically linked to hate crime, to just summarize it.
So what was the question you asked around that?
It's just a statement.
Right.
So we're just going to say 10 statements, and then out of those 10 statements, you've got to say whether technology had a part to play in anything that we state. What you think, whether technology, it doesn't have to, there's no right answer in this.
Sorry, that's a thinking. I think technology might have made it easier to report.
Okay, cool.
Yep. Yeah, and then everybody else, feel free to just like use the raise hand function just to say yes or no.
All right, cool. Yeah, you're totally right. Technology had a part to play in the way that it was reported. Plus, also, technology had a part to play in that some of those hate crimes actually, happened online, which is linked to technology. So this statement kind of highlights how, in terms of criminal activity and human rights, that is all, the fact that technology has to be incorporated in how crime is evolving, in the types of crime that happen, like harassment and threats. Those are all hate crimes. But on the other hand, it's also important to highlight that technology can do good in this situation in terms of hate crime. Facebook recently started to use AI newsfeed to basically combat against hate messages against the Rohingya people. I'm not sure if you guys have seen that in Myanmar, and it's, you know, that's where technology can actually play a good in terms of hate speech by using different softwares and different methods to combat hate crimes online. But I don't know if you guys had any thoughts on that. No. Okay, do you want to go to the global health statement?
Yeah. Yes, I just saw someone just said they don't know how to raise their hand. If you go on the three little dots that say more on the reactions bit, actually no, it's not on the reactions bit. It should be on the chat bit. There should be, if you click more, there should. Okay, you know what?
Just unmute yourself and talk. It might make it easier.
Oh right, yeah, it's the list of participants. Thank you. On the list of participants, it's in the bottom. Sorry. Yeah, so for global health, the statement is suicide rates among 10 to 24-year-olds have increased by 94% since 2012.
Dáre,
Oh, sorry, I thought raised hand was just to vote for it. I definitely do agree. If everyone's watched The Social Dilemma, that was a very obvious example, or they presented that argument. But they also gave some graphical data about suicide rates, not only in teenagers, but young children around age 10, increasing over double and in the past 10 years. So yeah, I definitely think technology has that influence.
Yeah, you're right. So the facts that they showed in that documentary, they weren't 100% proven, but the research that has been done has been linked to this, but it also is linked to this rise in not only like mental health awareness, but also the rise in isolation, which social media also plays a role in, and also rises in like bullying online and body image and all of those things, which are all also linked heavily to kind of social media usage, especially among younger people. So yeah, you are right. It did play a role. Next one.
Okay, the next statement is the United Nations reported that 76% of trafficked persons are girls and women. So how many people think this directly links to technology in any way?
Cool.
Yeah, I think so. I mean, it's so much easier now in chat rooms to connect. You don't have to go into your family room with your computer and log in front of your mum or dad. You're basically just doing it on your handheld phone, which is actually a necessity right now to most school students. I can't imagine anyone above the age of, 9 not having a phone.
Yeah.
For their own security as well as for connection. So it's much more easier to get access to younger people. So it's much easier to influence them and much easier to arrange a meeting place. So yeah, I can imagine that.
Yeah, so true. So true. Definitely technology has a big part to play in this day and age. I mean, in the United Kingdom alone, more than 8,500 cases related to human trafficking were done online. And that's quite a lot, and that's quite a significant amount compared to what the statistics have looked like over the past few years. But the good thing about, now, because the theme of this thing is to talk about tech for good, a lot of people have started to acknowledge this and start to do something about it. I mean, there are tools that exist, such as Microsoft's Photo DNA, where you can actually target the location of where some of these people are and the pictures that are taken for let's say children, for example. So technology does play a part, but there is, some hope in basically how technology can combat human trafficking in some of these atrocities.
Yeah, so next fact on the global health side, the percentage of people with common mental health problems receiving treatment has increased since 2020. So raise your hand, user reaction, anything is good. Yep, I see. Yeah, I see a raised some thumbs up there. So yep, that is true. So with kind of the rise of digital health, more and more people are able to access services online. So a lot of people are able to access therapy, and this isn't just kind of meaning that more people are like more comfortable to access therapy, because you don't have to walk into a hospital or walk to your doctor. You can, put all your symptoms in online and someone's there. You don't have to see their face if you don't want to. You have a lot more options, but also it overcomes barriers such as language. So a lot of migrants who can't speak English then have the opportunity to speak to someone who can speak their language within the UK. And also cultural barriers. So if you live in a predominantly white area, but you are a Black female, you have access to a Black therapist, which some people have said has improved the service that they get and improved how they respond to therapy as well, because the services are, yeah, exactly. Yeah, there's more openness in discussing mental health and seeking help as well. So yeah, that has played a role in it as well. Should we move on to the next one?
Yeah. Do you want to move on to the next section because of time?
Okay.
Yeah.
So yeah, I realized we went a bit over the 5-minute we'd allotted, so we will move to the next section. But the point of this section was just to highlight that a lot of the things that we are seeing, whether they be improvements or whether they be negative impacts of different things, they have been impacted by some sort of technological advance. Yeah. So just aware that my screen is no longer sharing, so I will just go back to sharing my screen. So, yep. So the next section, we're gonna give positive and negative examples of the impact of technology on both global health and human rights. So we're each gonna take a section and kind of talk you through a case study or short examples of things that have happened. And I'm gonna start with the global health side of it. So I'm going to focus mainly on something called the SDGs. So I'm not sure how many of you know about the SDGs, but just in case someone doesn't, they are the Sustainable Development Goals. So these are goals that were developed in order to provide this kind of blueprint to achieve a better and more sustainable future for everyone. So they take into account the idea that I said before, that global health isn't just about physical health or mental health. It encompasses everything. So these goals focus on things like having health access, but they also focus on economics. So bringing people out of poverty, and also country economics, ensuring that countries are able to use their funds responsibly and ensuring their funds are providing an equitable future for everyone. And also things like the climate change and the environment. So they cover everything that is included in what we say is a sustainable future. So including also human rights, so peace and justice. But more specifically for global health, one of the goals that we tend to focus on is Goal 3, which is basically ensuring healthy lives and promoting well-being for all people at all ages. And at the moment, those goals are supposed to be reached by 2030. We are in 2020 at the moment, and each goal, there are a lot of goals in there, each goal has different targets that it should reach. But at the moment, we have an issue where we're 10 years away, but we haven't reached all of our targets within goal 3 specifically. And I'm just going to give some statistics just to show kind of where the improvements need to be. So for example, in 2018, it was estimated that 2.6 million children and adolescents under the age of 15 died from preventable causes. And of those deaths, the 5.3 million occurred in the first 5 years. And that is something that is usually, again, they're preventable causes. So it's something that can be prevented. And in countries such as the UK, they usually are, although again, there are issues within the UK system and within healthcare provision within the UK. And then another issue is, would be that over 40% of countries have fewer than 10 medical doctors per 10,000 people. So you have an issue of, yes, you might have a good healthcare system, or you might have the tools to provide the healthcare, but you do not have the physical resources to implement that healthcare. And then another issue is, another issue that I'm going to give an example is that globally, adolescents and girls adolescent girls and young women face gender-based inequalities. So that is exclusion, discrimination, and also kind of like on a more directly health related one, they're at higher risk of acquiring HIV. They are actually still a group that is very high risk, especially within countries where the advances within HIV treatment, testing, and prevention are still something that needs to be worked on. So within sub-Saharan Africa and some places within Asia as well. So I say all these problems to say that all of these problems, they need solutions. And yes, within global health, we're producing solutions, but technology has power to produce solutions that can kind of propel our progress. And I'm going to give you an example, like a few examples of how technology has managed to do that. But before I give those examples, I'm just going to go over some barriers to solutions that technology would need to overcome. So some barriers to providing these solutions would be this idea of poor infrastructure and poor resources. So as I highlighted, you have this idea of brain drain, which is what I highlighted when saying 10 medical doctors per 10,000. So not enough people, or when people do qualify within countries where they have poor healthcare systems, meaning healthcare systems are systems that provide healthcare. So for example, the NHS is our example of our healthcare system. So when people do qualify to become a doctor within countries where they have poor healthcare systems, they tend to leave to countries such as the UK. And sometimes they're encouraged by some countries by the UK, you know, because there's many more benefits to it, to living here. When like in terms of immigration and the benefits that they get when they immigrate. Also, when you have poor healthcare systems, you also have out-of-pocket payments, so people can't necessarily afford to pay for the healthcare that they're going to get. So one easy example would be in the US, where people have to pay for healthcare. You hear a lot of people saying, well, I didn't want to get an ambulance because it was going to be expensive, I couldn't afford it. And then other things would be lack of funding by governments, or poor investments by government into what they choose to invest their money in. And also taking into account the impact of colonialism and how that impacts relationships between countries. So sometimes you can have a situation where a country does want to spend money on a specific issue, but they are not able to because they're getting donations from a country in the global north, so UK, Europe, and they are told where they should spend their money. That's one issue. And then also finally, stigma and discrimination is a final barrier. So people don't want to access healthcare because they feel that they are either part of a marginalized group. So they're a sex worker or a drug user, or they fear the repercussions of accessing healthcare for certain things. So I say that all to say, to kind of give a background into the solutions that technology can bring, and the examples that I'm going to give you guys. So the first one is an indirect example of how technology can improve global health, or help us to achieve the sustainable goal development of goal 3. So I'm not sure if any of you have heard of the Google Loom, but basically it was the Google Loon, sorry. It was a balloon that a project where they put a balloon over Kenya, and that was supposed to supply access to telephone services, communication services for communities. So originally, this was thought to be great because that meant rural communities would be able to access communications. A lot of people within Kenya were reliant on their phone to access, to talk to family, to access different things, to get money. So originally, it was just an economic benefit for everyone within these communities and a way to connect rural communities to the wider community and to the world. But what they later realized was this was helping people access healthcare that they couldn't access before. If you have access to your phone, you have access to a doctor. So you don't have to travel all the way to the next town, which might be expensive for you. You have to pay for transport. And then when you get there, you have to pay for services. You can now call your doctor up and you say, this is what's wrong with me. What do I do? And you can just go to your local pharmacist, or you can just treat yourself as best as you can. You can Google you can Google, or you can look up different things, so you can get educated on your health. You can now have access to services such as partner notifications. So something that they do within HIV services is that if someone comes in and they test positive, they will ask them, do you want me to alert your partners to tell them to get tested? So that's improving rates of HIV testing and reducing kind of deaths related to HIV, and like improving the amount of people that are accessing treatment and also prevention services. And then also with that, a direct way in which tech can kind of work to improve us in achieving this goal is using something like Zipline. So Zipline is a country that uses drones to deliver medicine. And they originally started in Uganda, I think, sorry. And they've now like migrated to different countries. For example, they're in Ghana as well. And basically this means that people who are within rural hospitals where they do not always have the resources to have all the medicines that they need, or all the equipment that they need, now could get access to those in a much easier way. They didn't, again, have to travel. They didn't have to pay as much to access these things. Or, you know, in the case of like when you have urgent treatments where travel isn't possible, people were more likely to survive. And then finally, another example is one called Omomi, where pregnant women within Nigeria were able to use a pay-as-you-go subscription on their phone to get one-off consultations. So this directly links to the part where I was talking about preventable deaths, specifically within children in their first 5 years. Services like that, where people are able to access their doctors instantly and they're able to give treatment instantly, they do reduce poor health outcomes as well. So yeah, but just in saying all of these positive impacts, I'm just going to point out that each of these things that I've brought out, they did have negative impacts. I'm going to focus on the indirect one because it will highlight why it's important to think of global health when you are working. So when they did the Google Loon, yes, it was a great thing, but one thing they then didn't think about was, firstly, how that would produce a communications monopoly. So if people can access this and they can communicate with doctors and such, but they potentially also added to the issue of inequality, because now it means that I have to pay a higher price. And if I can't afford that, there is now even more inequality, not just within my country, but within my direct community. Because before, all of us didn't have a phone, but now I don't have a phone and my neighbor does, and their health outcomes are now better than mine, instead of all our health outcomes being better. And also, yeah, so that is one example. Just for time, I will move on to the human rights bit.
No, I think you pretty much covered it. What Tafadzwa just explained pretty much it encompasses human rights, because health is a fundamental, element of human rights. And if people don't get access to healthcare in the most adequate way, then also human rights goals are not being met by countries and governments. But yeah, I think she pretty much encompassed it all, and how technology directly links and in links to technology. Time.
Oh, sorry, I think I've gone over a bit. So just for time, we'll go to the next bit. So kind of thinking about that, we're going to give you guys some examples of how you guys in your everyday life, in your work life, if you do work in tech, or even if you don't, if you work in any industry, how you can what you can do to positively impact global health and human rights. So I'll start off with directly what you can do. So the first thing would be to educate yourself. So read news articles related to global health, read articles related to human rights. Good places to look are places like Johns Hopkins. They have somewhere where they release information related to global health and human rights.
Yeah.
For global health, something like Global Health Now is always releasing stories as well. And they have different sections. So if you are specifically interested in health and tech, they have a health and tech section where they will publish different articles. Secondly, would be to advocate. So this isn't necessarily speaking for people and deciding what they deserve, but it's listening to people and then giving those groups who are marginalized a voice. So, and it doesn't have to be a big thing. It can be something as small as you are in work and they suggest a project and you think, well, if we implement that project, this community is gonna, have to pay a much higher price, and it's just literally just saying, oh, have you considered the impact on this community? That is an example of advocating. Whether something gets done or not is out of our power as like employees, but just bringing that to the forefront of your work. And then thirdly, just consider global health and human rights in your daily life and in your daily work. Again, like the advocacy part, just think about how this is the implications that this will have on communities in terms of the global health and in terms of their human rights.
Yeah, you can also use your skills and knowledge. You can volunteer in terms of human rights and global health is probably the easiest thing that you can do, volunteer your skills. There's a lot of, people who still don't know how to even use the internet or even basic Microsoft skills. Though if you want to start small, those are things you can do because they improve equality and access to some opportunities. For example, some people might not be able to get a job because most jobs now require for you to be proficient in Microsoft tools. So if you can offer your services to that person to teach them that, then it improves equality in terms of where they are on the level of getting a job or getting access to some things. Everything is moving online, like she was just explaining, healthcare systems. I know for my local doctors, it's moved online. You have to book appointments online, but for some people who are not a bit in the know, then they might not be able to do that. So just volunteer in your own community. That's what I would suggest. You can also, there's loads of organizations who do volunteer programs abroad as well. You can look into those. Also being a mentor for somebody is also a great way to use your skills and knowledge and just spread awareness about how global health and human rights can have an impact in technology, activism. As Tafaz was saying, being an activist doesn't mean that change will happen, unfortunately, but speaking out and saying something matters, however small it is, and it all starts with everybody saying bits here and there about things that you're passionate about that relate to global health and human rights within tech.
Yeah, and then more specifically, I don't know if we do have any students here, but more specifically, for students or for graduates. It's about bringing what you've learned into your role. So like we strongly believe that if from the start of someone's career, they are thinking about global health and human rights, that will have a huge impact, because if as you rise up, you will constantly remember that. So once you've educated yourself and once you know the issues and once you understand the issues, is bringing those things into your role, like I said earlier. Also, I think, again, just to emphasize the point, small changes can have a big impact. So I think it's important to remember, even if you are just making an impact on one person, or if you are just impacting your local community, that has a much larger impact than attempting to change, the whole of the UK system, or change how digital health is progressing within the UK, because that is great, but it's far harder than going to your local community and saying, what can I do? This is what I do. How can I help? And also continuing to engage within the global health sphere, as we've seen with the pandemic. When people don't engage, you end up in these situations. Pandemic preparedness is something that has been in the back of the UK government's priorities. If more people had engaged in that before, or if more companies and more people who have power and who had engaged in that potentially wouldn't have been the case, and we would have been in a better situation. And even now, as we move forward into finding solutions to these issues, and as we move forward to finding solutions to, for example, what Maud said, like online healthcare systems, things that technology does play a really big part in, staying engaged in those things, whether that's politically or as politically online, whatever you do, is really important.
Yeah, and then lastly, in terms of the development of human rights and global health in tech, the main things for us are inclusiveness. That's one of the pillars of what we do, inclusiveness of human rights, global health within tech, because they're both so integral to the advancement of technology, and we really can't leave them behind. And also transparency, and basically how the technology sector moves and advances, then also need to be accountable for some of the human rights implications and global health implications. And that requires transparency for that to be actually something that's productive and that's a good outcome. Collaboration also, all these sectors need to collaborate. It can't be an isolation of just the tech sector does its own thing, global health does its own thing, human rights does its own thing. It's a multidisciplinary approach that needs to happen for us basically to create a better world, as cliche as that sounds. And that's about it from us. Did anybody have any questions? We're over time, but we can probably take one or two. Any questions?
Yeah, I have a quick question. It's very broad. How exactly did you get into this? I mean, it's all well and good being aware, but how exactly does one get into more detail and into more depth around this as a career, in actually helping out and marrying technology, joining organizations which actually do this?
Yeah. In terms of global health, there are a lot of companies who are if you're specifically interested in like global health and marrying global health and technology together, there are a lot of digital health companies that are like coming up, especially within fields like mental health, and that are wanting to make sure that these two things are combined. But again, there are charities who have started working on kind of looking at digital health and how digital health is impacting our lives, but I can't remember the name of the organization at the top of my head, but I can, if you drop an email on the email at the end, I'll contact at the end, I will forward you like contacts of different companies within digital health. And then also global health is very broad, so you can be working as a journalist, and then you specifically focus on global health. You can be working within technology, and then you just work for a global, for a company that works within healthcare, potentially helping them improve their data or implement apps such as Babylon. Babylon is a good example of an app where marrying the two has worked but could be improved. You know, there's things that haven't been necessarily thought about. For example, this idea of inclusivity, so, you know, languages, culture, and all of that stuff. So yeah, and then also, like I mentioned before, places like Global Health Now or Johns Hopkins, they have specific sections for global health and tech. And within that also, sometimes they will post opportunities for research. If you want to go do I would suggest you do a master's in global, everyone does a master's in global health, but that is a really great way of kind of getting a niche like tech.
Sorry, it was more about you personally.
Oh, sorry.
But that was useful, what you guys personally, really.
Oh, okay. Sorry, we completely misunderstood. Yeah, well, I've always been passionate about human rights, and I did my master's and then I worked in the field in human rights, and I started to notice how much of pretty much technology was playing into everything, and how much it was advancing, and how imperative it was to the work that we're doing on ground or through research. Even going from the basics of collecting data, or collecting data in places that don't have access to technology. And a lot of people, it wasn't a thing in terms of considering that aspect of things. So that's how I got into that, and I wanted to find out more, and I thought it was quite important to focus in on that in terms of human rights and technology.
Yeah, and yeah, I did a global health master's, and then I've also worked for an organization that kind of was implementing a very small global health project on the ground, and also a project where students come and like discuss topics and at events for global health. One thing that I noticed was there wasn't much collaboration in terms of like when I was organizing these events with students. So we would organize an event, and then global health master students will come, and then we would speak about global health, and not many other, it wasn't really included, even though it was something that was very important into how we were working and how we would be able to progress. And also we were missing some of the solutions in terms of progression by not being inclusive of technology, or not, you know, understanding its true impact in that. And then working on the smaller project, there was just a lot of barriers to be able to implement a project. The project was based in Zimbabwe. There was a lot of barriers to implement the project, and a lot of those barriers were due to technology. So, you know, being able to access network, to access different resources for the workers was sometimes very hard when they were living in like a rural area.
Yeah, and also for me, another defining moment was because I work in the counterterrorism sector, and watching all the operations and how much of like really big impact technology plays in protecting all of us, and in protecting our human rights. I think that was a pretty big factor, and I was like, if this can be applied on this scale, why can we not apply it in other places, in basically empowering human rights in everyday life and in what we do, rather than just leave it to, you know, the big people to have that kind of knowledge, when it can be accessed pretty much everywhere. And I hope that answers your question.
Yes, thank you so much.
Cool. Does anybody have any questions? No. Yes. All right.
Yeah, if there's no questions, so we'll just put the contact details here. So if you want to know more about, you know, potentially volunteering opportunities or anything where any place you can get involved, we'll be happy to kind of direct you to different places.
Yeah.
But yeah, that's everything. And thank you so much, everyone, for coming. I hope it was useful.
Yeah.
Thank you both for tonight. It's been really informative. And I want to echo something that Fem said in the chat earlier. I have a natural distrust for any data collection as well. I'm like, I don't want you to have any information about me whatsoever. I want to be off the grid.
Yeah.
But hearing you speak tonight's really opened my eyes and made me think there are actually benefits to data collection, and it can change the world. So you've taught me something. Thank you very much.
You're welcome. Thank you for having us, and thank you for everybody who attended. We really appreciate it. If you have any further questions or any follow-ups, just feel free to contact us.
I just want to wish everyone a happy and safe Black History Month. It starts tomorrow. Let me know what you're going to be up to. Let's celebrate. We have a lot of great things to celebrate, and we have a beautiful history, so let's celebrate it. And I'm going to wish everyone good night.
All right.
Thank you.
Good night. Thanks.
Bye.
Bye.
Bye.